Health Beyond 2015, Opportunities for Engagement on Global Health Frameworks with Dr. Amit Thakker, Conference Director Africa Health Business Symposium 2016 and Chairman of Kenya Healthcare Federation.
What would the private sector do differently given the SDGs? I mean, is in Kenya, I mean, is it viewed as silly or realistic and a necessity?
Thank you, Zain, and thank you to CCA for giving us this opportunity. I think it's a very good point that Charles and both Greg have raised, and I'd say that we learn from history as well. When the MDGs first came out, people had the same comments. We had similar sessions. Who made the MDGs? And who are they made for? And by who? And for who? And there was all these discussions about whether we're going to reverse the trend of HIV, TB, and AIDS and maternal mortality. But what it really did is what Charles is saying, it's necessary to have goals because much as most of the countries have not attained the MDGs, there's been improvement in making sure that we've got reduction in maternal mortality, we've got reduction in infant mortality. People have given attention to TB, AIDS, and all the other conditions. So SDGs are good to have. It's broad. I think it depends on which side you sit. If you really want to just snicker at it and say this is not something that's going to help the health sector at all and business as usual, or you're going to make fundamental changes that's going to drive partnership and innovation to improve overall health. And I think that the way private sector is positioning itself in Africa is partnerships. The buzzword of public-private partnership, not only limited to services, but also in terms of regulation, leadership, framework, is going to drive a model of health system that's going to have both the players playing together. You cannot achieve healthcare when half the team is not involved in creating the health system. So the private sector now feels that it's 50% provision and delivery of services. It will get involved in making the difference in SDGs. So I think the private sector is looking at SDGs as yet another way of harnessing the partnerships that it's already started in many parts of Africa. It's funny you asked this because a visit to Palo Alto recently made me even more believe that private sector is working towards bridging the gap. It's not business as usual. And related to the kind of discussion we had today, we know that we have 7.2 million health worker shortage throughout the world. There's never going to be a time where we're going to say we have adequate health workers in this world. Sub-Saharan Africa has 26% of the world's population and has only 3% of the global health workforce. There's no way we're going to make medical colleges and schools be able to produce health workers that are going to be adequate for us to achieve a robust health system. So we need to have technology that's going to leapfrog this process. And I think one of the game changers is trying to use technology in providing access to services in remote and distant places in Africa. Through a new telemedicine model or through mHealth, I think we're holding a promise in taking health closer to the people, where healthcare does not start at the hospital doorstep, but at the homestead, where issues to do with public health are taken to the communities, where you don't need to measure the number of hospital beds to population, but you have public health issues trying to keep communities healthy and out of hospital rather than having MRIs and CT scans and measuring that saturation. So I think that we have one technology that I think for Africa is going to be a game changer, and that's mHealth. We've used it in the finance sector.
Can you just explain it?
The finance sector has used M-Pesa. We've got transfer of funds now happening larger than any bank in many countries, where the country I come from in Kenya, we have over 90% of our transactions through that. 98% of our population have access to a mobile phone. And so, when we look at healthcare, the two biggest barriers in Africa is geographical and financial. Now, if we are going to find solutions to those two barriers, then SDGs are going to be achieved. But it's not going to be the same old model that we've been discussing over the last 40, 50 years, because we will then end up getting the same indicators and the same old progress. So I feel that technology overlay with clever global health policies are going to make the game-changing situation in Africa and achieve better health indicators.